Good morning. I'm George Johnson. I feel good. How do you feel? Good, yeah. I'm in the pink. So are you. Welcome to the Informed Prostate Cancer Support Group. We are one of the largest on the West Coast. Also, we're very thankful for the Sanford Burnham Medical Research Institute for the use of this facility. And they also have a facility out the back door and down the hall in case you have need of that. I want to introduce our volunteers that make this program possible. We have Lyle. Where are you, Lyle? Here's Lyle. He'll be saying a few words later on. And then we have Gene, who will be saying some things. And then me, I'm saying something right now. Bill Manning, he won't get to talk until later on. And he's back there. He gets to stand through the whole meeting, looking through the screen. And then we have John. Where is John? John is in the back. You're supposed to be down there. Hey, the basket's down here for you? Okay. Bob Keck is our longtime librarian leader. And then Jim is there. Jim has a smile for everybody that comes in. Let's see that smile again. There he goes. Good work. Okay, the special event, we got a special award. It's the Harry Pinchot Award from the world famous Prostate Cancer Research Institute. They had a massive convention up at the Marriott LAX, over 600 attendees. 800. I didn't count very well. 800, and men and women, and wonderful speakers, a fantastic program. It was very uplifting, the best conference I've attended. I've attended all the last 4. And they have a special gala dinner where they give an award. It's a National Recognition Award for men and women judged by their accomplishments and personal attributes that show excellence in prostate cancer education, research, advocacy, and community support. This is a program awarded to an individual. But we have 2 individuals that have received that award. And the first individual is our president, Lyle. And I'd like to have him come forward and tell us about the award. He got this 5 years ago. Lyle?
Thanks, guys. Good morning. I'd like to thank you for all the good work that you do as a group, and that because of some individuals, we have become one of the most nationally recognized support groups. And this award, the Harry Pinchot Award, I never knew Harry Pinchot, but they called him Helpline Harry because he answered the phone at PCRI and help people. So that was his contribution. We have taken it to another level. We go get you. We advertise in the paper. We put out a newsletter. We have these meetings, and all of this is done under the efforts of one guy. And so he was nominated this year for the Harry Pinchot Award. And this is not to be taken lightly. It is they actually go and ask for nominations all over the United States, and there are some 1,800 support groups. So they get a lot of nominations. Now, 7 years ago, we were having our meetings over at the Ascension Lutheran Church. And some of you guys, I can look in the face and say, you were there. So after one meeting, this man comes up to me and says, I want to help. Excuse me. So he started to help. First thing he did was he put us on a computer. He started producing our newsletter. Next thing you know, he's writing the article so that when you see all of this great newsletter we put out, Gene does that. He does all of the organization for advertising. with George's help. They create the ads that are so successful in the newspaper. He is our financial officer. He maintains a great set of books that are open. He does all of our reporting for the government. If there's a one-man guy, it's Gene Van Vliet. So in recognition of all the things that he does, this is the national award that was presented to him at the convention at the PCRI National Convention in Los Angeles a week ago, 2 weeks ago. And I couldn't be more proud of him. And 2 years ago, we nominated Richard Prophet for the award, and he received it. They had a pact. So in the last 5 years, we have effectively won this award 3 times. That's pretty damn good.
Thank you, Lyle. As I mentioned at the conference, I never realized when I volunteered how gratifying it would be to be involved with the support group. So it's a labor of love, and it comes back to me many times from being able to help you find your way through our disease. Now we'll, this type of meeting that we'd like to call a roundtable, we're going to have a couple of guys talk to you about their experience in working their way through dealing with the disease. Afterward, we'll have some questions and answer type sessions. Then we're going to break up into groups by treatment type so you can network with each other. We always think this is a good time. So who wants to be first? Who cares? Len, you want to do it? Okay. So Len Molkowski is the first man up, and he's had quite an experience, so let's let him talk about his...
Morning, everybody. Can you hear me okay? My name is Leonard Molkowski, and I've been attending these Informed Prostate Cancer Support Group meetings for about 2 years now. And I'm really grateful for all the guest speakers and all the information that's become available to me. So I really appreciate that, and I'm very grateful coming to these meetings. I thought really hard about where I should start to talk about when Gene, my journey with prostate cancer, when Gene asked me to speak. And I think the best way to start, or the best place to start, is actually telling everybody where I am today, because it's a really good part of my life right now. Things are going really, really well. I turned 61 years old this past July. I've been on this journey living with prostate cancer for 13 years now. And if you do the math, I was diagnosed at 48. And that's younger than most. I might not have been the youngest person ever, or the youngest person in this room diagnosed, but younger than most. I had my last PSA check less than 2 weeks ago, and my PSA is 0.03, which is almost zero. You might as well just call that zero, which is really good. And I feel well. I feel strong. I feel energetic. I'm a very busy guy. I have a full-time job. I go to the gym after work most days, and I'm very grateful for where I am today. And if you were to ask me 13 years ago if I was still going to be here and be able to talk to you and tell you how well I'm doing, I would probably say no. So this is a pleasant surprise for me. And I'm going to start in a very kind of unique place, I think, to tell you about my story. 13 years, probably this weekend, it was just about 2 weeks after the 9/11 attacks. And I remember my wife and I watching all of those videos on TV of the World Trade Center collapsing, and I took those attacks very personally. I'm from New York City, and I took my wife to the World Trade Center when we were dating, and we were very upset watching all the bad news, all the sad news. So finally we said, it's time to have a little bit of fun. Let's do something that's fun. And we decided to take my daughter, who was only 4.5 at the time, to Legoland, which is an amusement park up in Carlsbad. Anybody been to Legoland with their kids or their grandkids, perhaps? And something kind of funny happened that day when we took my daughter to Legoland. She didn't want to walk. She asked me to carry her. She said, "Daddy, hold me." And I carried her all day for about 6 hours, from ride to ride and from no lines and lines of rides. And by the end of the day, I had a sore back. I had some lower back pain, and that's why I'm telling you this story. Coincidentally, I had an appointment for my annual physical the next day to see my internist, and he said, "How you doing, Leonard?" And I said, "I'm doing really, really good." The main reason I had gone to doctors up to that point in my life is that I have asthma since I'm a child, and my asthma is really well under control. I said, I'm feeling great. I have good energy. I don't have asthma symptoms anymore. I throw my inhalers out because they expire, not because I use them up. And then at the last minute, I just said, "By the way, I have some lower back pain because I carried my daughter all over Legoland yesterday." And he did what really good doctors do. He took notes and he listened to me. And I was only 48 at the time. He decided to run my first PSA that day because I complained about lower back pain, because my daughter asked me to carry her all over Legoland. And the reason that that is really unusual is that he didn't test anyone before they were 50 years old at that time. So if I didn't go to him complaining of lower back pain, I would have waited 2 years for my first PSA. And that was kind of coincidental or kind of lucky for me because he called me a few days later and he said, "Your labs look really good, but your PSA is a little bit high." And it was about 5.8, I think. And he said, normal is like 0 to 4.5. It's a little bit high. Let's just run the test again and see what happens. And about a week later, I ran the test over again, and it came back a little bit higher. It came back about 6.3. And we ran one more test, and I think it was about 6.9 the next time. And he finally said, "I think it's time to go see a urologist. I think it's probably nothing. It could be an infection, but why don't you just follow up and get it checked?" So we went from September to early October after repeating my PSA about 3 times. And I went to the urologist, and the urologist said, same thing to me. It's probably nothing, but it's time for a biopsy. And just to be safe, just be on the safe side. And I don't know if there were color Dopplers 13 years ago. If there were, he didn't use it. And he did one of those blinded biopsies with the 9 or 12 specimens that he got out. And I get a phone call on my desk one day at work, and it's my urologist. And he said, "Your biopsy came back positive. Your Gleason score," I never knew about what a Gleason score was before. "Your Gleason score is 4.4 plus 4, and that's a symptom of very aggressive disease. And you and your wife should come in and see me right away to discuss your treatment options." And I kind of had an out-of-body experience at that moment because I kind of couldn't believe what I was hearing. My back pain had gone away. I had a 4.5-year-old daughter, and I just found out I had prostate cancer. So, in fact, I put my doctor on hold, and I got my wife on the phone, and the 3 of us talked together on a conference call because I wanted her to hear it directly from him in case I forgot anything important that he had to say. And it's very memorable what day that was because it was October 30th, the day before Halloween. And I remember we took my daughter trick-or-treating that next day, trying to smile, trying to be normal, trying not to be afraid. But we were very afraid. We were very uncertain about the future. And I think that's a big part of what happens when you get diagnosed is that you just wonder, you're just very fearful, and you wonder what the future holds for you. Went back to the urologist's office as he suggested and had our consultation. And my wife's a former ICU nurse, by the way, and I used to work in the hospital as well as a respiratory therapist. And we wrote down a lot of questions to ask him. And we asked him all the hard questions. And we asked him, what are the chances that the cancer had spread already outside of my prostate? And he gave us the hard answers. He told me I had a 20% chance that I already had metastasis. And we asked him if I had surgery and the surgery didn't cure me, how long was I going to live? And he said, based on your Gleason score, based on Parton tables, and he threw a lot of words at me I never heard before. He said probably 1 to 2 years if the surgery doesn't cure you. And the surgery is the only chance for cure. We asked about medical treatment. Is there chemotherapy? And he said no. There was no chemo. There was no FDA-approved chemotherapy to treat it. And we had to think really hard and really quick. And I don't know, surgery seemed to be the right answer. I heard 20% chance that it had metastasized, but I was thinking I had an 80% chance that it didn't, and that surgery might cure me. And being 48 years old and having a 4.5-year-old child, I wanted the cure. I wanted to be well, and I wanted to live more than 2 years. So I did schedule surgery very shortly after that, and had surgery, and had a very uneventful recovery. And I remember being discharged and still having the Foley catheter in me. They keep the Foley in for about 3 weeks after surgery. And I remember going back to the urologist's office 3 weeks after surgery to have my stitches removed and to have my Foley catheter removed. And got some more bad news that day. I found out that I had incontinence from the surgery. I had a lot of leakage from the surgery and wound up leaving the urologist's office that day wearing a diaper. And that was really hard for me. That was a really big shock at that time. And I had a lot of hope that things were going to get better, that that wasn't going to be my baseline, but I wasn't quite prepared for that. That was really kind of hard for me. Had one final visit to the urologist's office 4 weeks after surgery, because this was the big day to test my PSA after surgery to see if I had been cured or not. They want 4 weeks to pass for your PSA to go down to 0. And if you've been cured, your PSA should be 0. And if you still have a measurable PSA after surgery, it means that there's probably prostate cancer cells in your body that is creating the PSA. And when I came back that month after surgery, unfortunately, my PSA was something like 1.1. So that was my proof that the surgery didn't cure me. And I said goodbye to my urologist that day. I didn't have any use for him anymore. No, there was nothing else that he could do for me. And I had to find a good oncologist who could help me. And I went back to my intensivist who did my first PSA, and I said, who should I see? And he recommended me to an oncologist that many of his patients have been using and doing very well with. And what was really great about being introduced to this oncologist is that he didn't give me any guarantees, he didn't give me any promises, but he gave me hope. And he gave me a treatment plan that we were going to start right after the first of the year. And that treatment plan started with a 4-course dose of chemotherapy called Taxotere. And I had been told by the urologist there's no chemotherapy for this, but I guess he was wrong. So I started my Taxotere therapies right after the first of 2002, and went in the treatment room at Scripps Hospital, and saw lots of other cancer patients in that treatment room, a lot of people a lot sicker than I was. And after the second of my 4 doses of Taxotere, I had another PSA, and it was still climbing a little bit, slowly, but it was still climbing. And my oncologist decided, instead of waiting, which the original plan was to wait until the Taxotere was complete, and then to probably start me on hormone deprivation therapy at that point. And instead of waiting until the Taxotere was over, he decided midway in the Taxotere therapy to start it earlier. And I started to respond very quickly to a medication called Zoladex. I had an injection in my belly every 90 days. And I had that injection for the next 2 years, every 3 months, religiously. And my PSA took a big nosedive and hovered around 0 for 2 years. And I was really happy with that. I was feeling good, and I was really happy with that. And my oncologist said something interesting to me then. He said, if the cells that I had in me, if the prostate cancer cells I had in me were very hormone sensitive, and my PSA was kept down near 0 with the hormone deprivation therapy, that there's a chance, and I never heard this term before, that that therapy could be cytotoxic, which means the cells could die. The cells could just shrivel up and die because there's no testosterone for them to grow with. So I went on a vacation of my hormone therapy for almost 2 years, for about 22 months. And my PSA was checked every 3 months, and it stayed around 0. But almost 2 years later, it started to climb again. It started to rise again. And I found that very disappointing. I think I was living in La La Land, and I thought that maybe it was just going to go away and it was never going to come back again. And I found it so disappointing that for the first time, I wanted another oncologist's opinion, because I just wanted to make sure that everything I had been treated with was everything that's available to me and everything that could help me. So I made some phone calls. I told you I'm from New York City originally. I made some phone calls, talked to some friends, did some research on the internet, and I found an oncologist at Sloan Kettering Hospital in New York City who specialized in prostate cancer. And I made an appointment to see him. And his secretary asked me to gather up all of my medical records, all my lab results, all my scans, even my pathology slides from my prostate when it was removed. By the way, when they took out my prostate after surgery, they increased my Gleason score from 4+4 to 5+4. So I actually had a Gleason of 9 after they examined the whole prostate after surgery. So I went to New York and I went to see this doctor at Sloan Kettering, and he examined me very thoroughly, and he looked at all of the test results that I brought to him, and his pathologist studied my pathology slides, and they found something in my pathology slides that they didn't find in my local hospital here, and they found evidence of metastasis inside one of my lymph nodes from my pathology slides that my own hospital had missed. And it changed my staging. Everyone familiar with the concept of staging cancer based on how far it's progressed? You're a stage 1, stage 2, stage 3. So finding that there was evidence of metastasis in my lymph node on that pathology slide, they changed my staging from T2 to T3. But because I was treated very aggressively by my oncologist, because I had chemotherapy and hormone, I went on Zoladex, I went on hormone deprivation therapy. The fact that the lab missed that didn't seem to be detrimental, didn't seem to hurt my chances for my recovery or for my living with cancer. So I went back to San Diego feeling everything that could be done for me was being done for me in a very positive way. I went back on hormone deprivation therapy. And for the next 6 years, the Zoladex did wonders for me. My PSA went back down near 0. I felt well. I had good energy. And in 2006, just about 6 years after all of this happened, my PSA started to go up again. No, that was 2006. In 2012, my PSA started to go up again after being on Zoladex for another 6 years. And I found that disappointing. And every time I had a checkup, it was a little bit higher, and it was a little bit higher, and it was a little bit higher. And just about a year ago, this time of year, in September, my PSA was 14.91. It was almost 15. And I said to my oncologist, it's time. We have to start something new. We have to start another type of therapy for me. I was feeling that gloom and doom and fear again only a year ago. And we had talked for a while about some other possible therapies, and we both decided it was time to start. So last October, my doctor ordered something for me called Zytiga. It took a while for my insurance company to approve it because it is a fairly expensive drug. I take 4 capsules a day and every morning on an empty stomach. Along with the Zytiga, you have to take a small amount of prednisone every day because it prevents your body from creating its own corticosteroids. Everybody needs a little bit of steroid in their system. So I take 2.5 milligrams of prednisone a day, twice a day, which is a very, very small dose. I've been on much more prednisone when my asthma was out of control at earlier times in my life. And it took about a month or 2 for the Zytiga to appear to work, but my PSA took a big nosedive from that 14.91 high. And at the same time, last December, my doctor thought it was a good time to start something called Provenge therapy. And Provenge is classified or identified as what they call immunotherapy. So they basically use your own immune system to attack the cancer cells. And the process for going through Provenge therapy is you have to go to the blood bank, and it's 3 treatments only. You get 3 rounds of treatment with Provenge. And I think Jean has spoken about this once before. You go to the blood bank and you sit in a chair for about 3 hours, and they connect you to a machine called a plasmapheresis machine. And your blood goes through this machine, and this machine has a centrifuge in it, and it separates your white cells, which are the cells that fight infection, from the rest of your blood, and they give you the rest of your blood back to you. And it takes about 3 hours to go through this plasmapheresis process. And they take this pack of white blood cells that they took from you, and there's a courier there's a gentleman from a company up in Seal Beach, California, up in Orange County, called Dendrion is the name of the company, and he takes your white blood cells back up to the lab in the company, and they treat them some way, magically treat your own white blood cells. They program them to attack the cancer cells. And 3 days after your cells are removed from you and they're processed, they're returned to you. So 3 days later, I went back to that same treatment room that I had my chemotherapy in many years ago, and they would give me my white blood cells back in 3 rounds of treatments, 2 weeks apart. The first infusion of getting my treated white blood cells back to me, I had no reaction at all. I felt great. I went back to work the next day. The second treatment hit me like a bus. They watch you for like an hour after they infuse the white blood cells, and about 5 or 6 hours later, I developed a fever and chills, kind of flu symptoms, and my fever went up as high as 105 that night. So my wife rushed me to the urgent care center, and they just treated me with Tylenol and ibuprofen to get my fever down. And I had one more treatment after that. Fever a little bit of about 101, not as severe as the second time. But that's it. You go through this 3 times. And the one thing that's interesting about Prevenge is there's no real test, there's no real way of measuring how beneficial it is or how well it helps you. The studies just show that patients who are treated with Prevenge do better than patients who aren't treated with Prevenge. And the patients that they studied in order to get their FDA approval were men who were in very advanced stages of cancer, and it extended their lives only by months. But someone who's in a much earlier stage of cancer, it should extend your life by many years, is a theory. So that brings me back to September 2013. This is September, so for the past 9 months, my PSA has remained around 0. I'm still on Zytiga, 4 capsules a day, every day in the morning, two small prednisone pills, 1 in the morning, one in the evening. I feel well. I have good energy. I work a very busy, demanding job. I go to the gym after work. I've lived to see my daughter grow up. She's 17 and a half right now, and she's a senior in high school, and that's a really big deal to me, because when I got this news 13 years ago, I wasn't sure that was going to happen. And I guess the motto of the story is, if your daughter says, hold me, you should hold her, because it gave me back pain, and that's how I got diagnosed. And another thing, my doctor told me, my internist told me, that because of me, he changed his protocol. And instead of waiting till a man is 50 years old, he checks every male patient at 40 now because of me. So if I had something to do with him changing his protocol, I feel pretty good about that, because maybe some other man will get diagnosed earlier and have better treatment and better outcome and everything like that. And that's kind of what's gotten me here today. Yeah. Thank you.
Just maybe 1 or 2 questions. It's better, I think, is after we sort out into groups that you have conversations with him directly. But go ahead. You got one over here? Shout it, please.
Leonard, you started out at Legoland with your back hurting, but I don't know the relationship between the back pain and the cancer.
I think one of the early symptoms if someone doesn't have their PSA checked is they have lower back pain. One of the early symptoms that men have when cancer has metastasized outside the prostate is lower back pain, or some blood in their urine.
Was that
and my doctor? No, I didn't have. I don't have any visible metastasis on any of my scans. Whatever I have is too small to show up on the scan. But it's made my doctor worry enough to run a PSA 2 years earlier than he would have normally. Normally I would have waited 2 more years for that PSA. I'm glad I carried her and got it back.
Yeah.
Is what I'm trying to say.
Yes. Go ahead.
Is Zytiga, is that a hormone deprivation therapy?
Yes, it is.
Okay.
Yes, it is.
It's like
So it keeps
industrial
my
strength.
testosterone down below 10. That's what my blood tests say, less than 10 when I got my results back. It's only been out about 4 years. It hasn't been out very long, but it's working for me.
So it's more powerful than what you were taking earlier?
What I was taking just stopped working. I became hormone refractory to the Zoladex.
Okay, let's move on, and then you can ask specific questions. He'll be available with the breakout session following this. So let's move on to Paul Potash, and let him talk about his experience, which is much less than Len's, fortunately.
Can you all hear me okay? Yeah, my name is Paul Potash. I'm 68 years old, and I was diagnosed with prostate cancer about 3 years ago. And just to give you a little history of my health, I don't take any prescription drugs. My blood pressure is fine. I've been physically active. I've ate fairly well my whole life. My wife and I, many years ago, had 2 children. And we raised them, but about 14 years ago, my wife was diagnosed with breast cancer, and all of a sudden, we were thrown into the medical arena. My wife, God bless her, survived, and she's doing super well today. But why I mention that is it brought to light the information for somebody who doesn't have to go to doctors, how important it is to ask the questions and to have an advocate and to have information at your fingertips. Also, how scary as well as how good the internet can be for information, and we all have to remember that. So getting back to me, I'm probably well known in my group of friends of being somebody who doesn't really like to go to doctors and puts off tests as well as I can put them off. But I did go in about 3 years ago for my annual physical to a really good internist up at Scripps Clinic, and everything checked out fine until I got a phone call. He said, your PSA came back a little high, 5.4 if I remember correctly. That was about 3 years ago. You should go see a urologist, and I recommend so-and-so up at Scripps Clinic. Well, you can imagine, since you're all here, what kind of a gut wrencher that information is, especially to a guy who actually I've never spent, other than maybe being born, I've never spent a night in a hospital, I'm happy to report. So it really threw me for a loop. I went to a urologist, and right away the conversation went to, listen, Paul, we should probably do a biopsy. And that, of course, threw red flags up in my court because a biopsy was an invasive procedure, and I didn't even know the half of how invasive it was. But I tried to put it off. I'm very good at putting things off. And I started doing some research, and I also would talk to my urologist. And he agreed, okay, let's keep an eye on your PSA. Let's do this every 3 months, and we'll check your PSA. So about 3 months later, I took another PSA test, and it crept up a couple of points. I think it went to almost a 6, and about a few months later, 6 point something. And he started hitting me with the biopsy again. And again, very hesitant to do that. Had done some research. My wife is terrific on doing research in this field, seeing what she went through years earlier. And I grew up with doctors in my family and my life, and had a lot of information available to me. So I kept trying to put it off, and my urologist finally said, well, you know, Paul, there is another test that we could run. And I was appreciative of him to give me an alternative to a biopsy, and that's a PCA3. I don't know if any of you have ever heard that or had that done. From what I understand, it's an expensive test, which is really a shame that that would be a reason not to give that sooner rather than later. And it examines certain specifics in your urine. It's not a blood test. And it comes back with a percentage that puts a flag or not up on your chances of having prostate cancer. Mine came back at about 65% chance of having prostate cancer. So with that information in mind, I finally agreed, and this is about a year after the original PSA test, to do this biopsy. So I did the biopsy. They took 12 cores, and a couple of weeks later, I got a phone call, and it was another one of those phone calls. And he said, Paul, I've got good news and bad news for you. The bad news is you have prostate cancer. The good news is, as probably all of you know now, the Gleason score, which I actually was pretty unaware of what that meant, was a 6. So you have various options available to you. And one of them is a radical prostatectomy, another one is radiation, and another one is active surveillance. So I had to think about that for a microsecond, because I'm a perfect candidate for active surveillance. And I said, let's do that. So he said, fine. And he said, I've had patients that have gone for years and years with active surveillance. And that was very reassuring to me. So I started on that route and it was basically the same thing I was doing before, of every 3 months getting a PSA test. And about a year and a half ago, actually it was, closer to a year ago, around this time a year ago, my PSA was around 6 each time, and then I actually got it down to 5. And I'll go into it a little bit to let you know what I was doing to help bring it down, if indeed it was helping. But it came back at 22.5. And it was bingo, another one of those gut-wrenching informations. And immediately I said, let's get an appointment. And the nurse at Scripps said, well, your doctor's doing surgery all week, and he can't see you for about 7 or 8 days. Which, if you think about it, you're just telling somebody he's got an off-the-charts PSA, and he's putting you off for a week and a half, and you've got to live with this information. And as good as I am at putting things off, that was still really a serious hit on my approach to this disease. And while waiting that week and a half, I began to think about, what are my alternatives? And it was just about that time that the new proton therapy center opened up here in Kearney, I guess it's Kearney Mesa area. And it was touted as being the most accurate and the safest solution, and very specific. Prostate cancer seemed to be at the top of their list of treatments that this was designed for. And I'm a very high-tech person. I'm very involved with computers and other things like that. And I put a lot of faith in technology, and I was thinking, maybe I have this monkey on my back, and do I really want to, maybe I just can take care of this and get this done. So I went up there, I had an appointment, and I went with my wife, and I met Dr. Rossi, who was very well known in this field of proton therapy at Loma Linda for many years. And I read a lot of stuff that was written about it. There's a support group got a curious name, their support group, the Balloon Group or something. Which is it? Brothers of the Balloon, right. And it sounded to me like, oh, well, there's a little humor in this too. Maybe this is perfect. Well, I got to this center. It was sort of a ghost-like hall, but like a Four Seasons hotel. The place was beautiful. It was non-medical looking as one could think, but it was empty. There was one person at a desk. I waited for a while, and then I went in and I saw a nurse who took my vitals, and then Dr. Rossi came in. And I was quite enamored with Dr. Rossi. He spent over 2 hours talking to me. And I thought, this is terrific. This is something that I'm feeling good about. And despite the fact that this place is empty and new, maybe indeed this is the way to go. So I began to think that this is going to be what I'm facing, and I started reading some more details about it and realized that it's not a walk in the park. There are a lot of potential issues with it as well, and maybe I should rethink this a little bit, but I didn't have anybody else to go to. I have a very dear friend whose brother-in-law is also a dear friend, great people, known him for many, many years. And my friend was having dinner with his brother-in-law, and he said, he asked how I was doing. We both have surfed together over the years, and he hadn't seen me in a while. And my friend told him, well, you know, Paul's got prostate cancer, and he's thinking of doing this radiation treatment. And he said to my friend, he said, please have Paul call me as soon as possible. I really want to talk to him. And I was told this to call him, and my first reaction was, here's another expert, you know, somebody else who's read stuff on the internet. I've already done that, and what is he, you know. But I was open-minded about it. And he said, I have a really, really old, great friend. And he started several years ago a prostate support group. This guy is incredible. I'll be having lunch with him, and a doctor will call him from New York or Quebec or somewhere far away, asking, a doctor who is a specialist in this will be asking this gentleman, what do you think about this or that or about a latest development? And I'm going to give him a call and ask if he would mind talking to you. And I said, well, that's great. And as you know, it's Lyle who started this, and Lyle called me back. And Lyle spent almost 3 hours with me, and I got to tell you, it's probably singularly one of the things that has changed my life, and hopefully will continue to change my life, with the direction and the information he gave me. I don't have a lot of technical terms to share with you. Active surveillance is something that is really need to be made aware of. And Lyle gave me tons of specifics, things I never even knew about, and invited me to come to the group and invited me to read the newsletters. So when I was thinking about coming in front of you all, because I'm sure you're all well informed, I thought there was some real little sort of hot tips or hot points that we should know about. And if you don't know about them, it's a really good thing. One of them that was something I was resisting the most was this biopsy. And what I learned about, again, through the grace of Lyle sharing his knowledge and all the gentlemen here sharing their knowledge, is the biopsy that they do on your prostate is called a non-targeted biopsy. It's the only place on the body that any doctor will give you what's called a non-targeted biopsy. And basically, they're going in and they're sticking needles in a haystack, so to speak. And it was, an analogy was made. Can you imagine if a woman went in for a breast cancer biopsy and they just started poking probes into her breast randomly? I guess it's called a random biopsy, not targeted, looking for breast cancer, and how inaccurate that is. I should go back a little bit, and when I was arguing with my doctor earlier on before the biopsy, my wife had suggested, and a European doctor that we know also suggested, an MRI. And my urologist, who is very well rated up at Scripps Clinic, said, you know, an MRI doesn't work in prostate because the cancer cells are so small that it's really not a reliable detector of a cancer cell in your prostate. And I was kind of disappointed because that's a non-invasive. I have learned that he was totally wrong on that. I don't think it was maliciously wrong, but uninformed. I guess it's really, there's a lot of progress being made, and it's not easy for doctors to stay up with it. Their schedules are really tight. Another point that came up that really gave me hope of being an active surveillance candidate was that the AMA and other organizations are actually pushing to call a low Gleason score of 6 to stop calling it cancer. I guess it is a cancer. I mean, I don't guess, it is a cancer, but it throws up such an alarm in patients that it is basically recognized as the most overly treated disease in the history of medicine, of going in after cancer. And in almost 85%, it's unnecessary. And over these last couple of years, I've run into a neighbor of mine who was a captain in the fire department. I hadn't seen him in a while, and he had a radical prostatectomy. And I said, wow, I'm really sorry to hear that. He had a huge amount of problems, I'm sorry to report, as a result. Excuse me, as a result. And I said, well, what was your Gleason score? And he said, 6. I couldn't believe my ears. I didn't have all the information I have now, otherwise, and it would have been a little after the fact. I ran into somebody else who I know, a strong, super athletic guy who, when he shakes your hand, he breaks it every time. And the poor guy was reduced to just a physical mess, and he had a Gleason score of 6 and went for radical prostatectomy. And I really couldn't believe it that there was so many men out there, a cousin of mine, the same deal, who was actually on active surveillance, though, with a Gleason of 6. And I was thankful to hear that. How little information there is other than this and the internet, and how lucky we are to have this at our fingertips and in our neighborhood. In my own personal run of these PSA tests, my doctor who came in after I saw him with this 22 walks in and starts talking to me and didn't even mention this 22. And my wife and I are sitting there figuring we're going to be on this road to a lot of medical procedures. And I said, well, doctor, how about my 22? And he goes, no, that's an anomaly. They might have made a mistake, unlikely, but you might have had a little infection. I don't really see any problem with that at all. Let's recheck it in four weeks, I think he said, and I'm sure it'll go down. And, you know, the medical profession is incredible, but to have somebody wait 8 days to have you, they couldn't tell me that on the phone when I called with it, to get information. It's really kind of, I mean, when we sit and when we go to bed and we try to close our eyes and fall asleep, for 8 days, knowing we have this PSA that could mean really serious stuff to our own health, it really kind of upset me, but I said, well, I'm happy to check it. And in 4 weeks, it went down to 6. I was real happy about that, naturally. And I really thought that I would continue on with my active surveillance and not go through this proton therapy. And I am happy to report that I had my second one since then, and it was actually 2 weeks ago, and it was a 4.4. And I'm thinking, yes, if you would have been anywhere in La Jolla, you would have heard me that morning when the information came in. I was really stoked. And I've mentioned it to a couple of people, and their first question is, what do you think you did to improve? And I immediately actually kind of said, I never thought of that, but that's really a good question. We have a dear family friend who is actually worked at Kimmel as a researcher into cancer for many years. My wife and his wife started a foundation getting medical instrumentation directly to researchers rather than to the institution, so they would have a piece of medical apparatus that they would need for their research. And as things went, I hadn't talked to him in a while. He was specializing in the last couple of years in prostate cancer. And he, amongst other things, was telling me that, Paul, if there's one thing I could think that you should know about is that cancer cells love sugar, and they thrive on sugar. And I'm not a big sweet eater. I don't eat desserts with our dinner. We actually eat mostly vegetables in my house and fish, and we stay organic and everything. And we don't eat a lot of meat. But I did have 2 teaspoons of sugar in my 2 mugs of coffee every morning and a dessert when we went out to dinner. And I cut that out, which was tricky because I've been a lifelong sugar in my coffee guy. My wife actually teaches Qigong. I don't know if any of you know that's an ancient Chinese meditative physical movements around meditation. Tai Chi grew out of Qigong. And there are actually hospitals in China that actually are patients that are considered unoperable and uncurable, if they qualify through a bunch of psychological tests, are sent to this hospital in China, where they have cured people through meditation and physical exercise, literally cured. I mentioned this to a doctor who's the chief of cardiology at Sharp, and he said, "Oh yeah, we went up to that hospital a bunch of years ago with a bunch of interns. Yeah, we know about that." But that was about it, all he had to say. So about 2 years ago, my wife was always getting me to try to do this. I'm an undisciplined person. I love to do things that have a payoff, like a great wave in a surf, or, anyway. I kept saying, honey, I appreciate it. I don't really need it. But she got tired of hearing me complaining about aches and pains and other things, and so she stopped. And once she stopped nagging me about it, I began to think that maybe she was right. And I started doing a 20-minute exercise every day around sunset, and I have missed it maybe once or twice in the last 2 years, of the Shibashi routine, which is breathing and sort of Tai Chi-like movements. And Qi is an energy of life that actually has been quantified by scientists, and it's not a spiritual thing, it's a real thing out there. I can't give you any more technical information about it. I'm not in that, or I'm not a scientist. But it's pulling the energy of life and around you into you for your own good and for those around you. And I basically would do it every single day, and I continue to do it. If that's having any effect, I don't know. But I read a great book a few years ago on placebos, written by a top pharmacological guy who ran pharmacology companies, was very successful, and completely got out of it as he began to research placebos and how effective they were compared to actual chemicals that people were taking. So anyway, getting back, so I'm a very happy camper right now. 4.4, active surveillance, blah blah blah. I thought maybe there's one thing in particular that would be important to know, that if you are indeed a person that is a candidate for active surveillance, and that is basically when you put your head down on a pillow, or when you're down about something, or work is not going well, and if your mind starts going into your cancer and thinking, damn, this is bad, and I can't live with this. And, maybe if you can't get around that, maybe you're not a candidate for active surveillance. But if you can have faith in the knowledge that this wonderful group brings to you, and the amount of information that's getting, and the amount of developments, and can get around that. Listen, I still worry about it. Believe me, I was a basket case for when I heard the 22 number. But if you can find a vehicle within yourself to hang in there, and one of the benefits of hanging in there is the longer you hang in there, the more research is going to come. And listen, if I got diagnosed with that today, and I opened some information that this group has disseminated, I would go, hell, I don't have cancer. They're not that's just some other thing. They're not calling it cancer. I would totally from my heart say that stay with the active surveillance as long as you can. Do what they say to do with your PSA tests, and maybe, listen, we can all clean up our act a little bit, eat a little bit better, spend a little time with yourself and calm the stresses of life. I think stresses are one of the things that messes us up in ways that we don't even know about yet. And look around and look at the beautiful place we all live in here, and the wonderful people who are here to help us with all this stuff. And we all have a great chance, and I think that's about it.
Thank you very much. Paul will be up in the section on active surveillance, so direct questions, I'm sure you'll have a lot to talk with him about. Go ahead, George.
I'd just like to, before we go into our networking, just give you an overview of the Prostate Cancer Research Institute's convention. Save you about $120 in 5 minutes. Okay, general themes. This is my notes on this. Continued progress in prostate cancer research. Tremendous progress. very important early detection. And you heard from Gene, and it was a common theme at the conference, get your PSA test, encourage others. There's more clearly delineation of between low risk and high risk. The PCRI has a kind of shades of blue. It really boils down to high risk and low risk. And the key factor there is a Gleason of 6. The value of combined treatments, giving multiple treatments and combining things like Lupron with Casodex or Zytiga with other treatments or Provenge with Casodex, things like that. They're learning that those doubling effects or synergy have value. And then there's tremendous progress in diagnostic and imaging techniques and getting early detection of cancer. On active surveillance, it's the best approach for low-risk prostate cancer, if a Gleason of 6 or less. MRI is not a good indicator of a low-risk cancer, and that's good news. The point there is it doesn't give something a urologist wants to do surgery on. So it won't show on the current MRIs till it's pretty obvious that it is a higher risk prostate cancer. Okay, the concerns about active surveillance is we heard a little bit about that. It's another phrase for PSA, prostate-specific anxiety. What's it going to do? How am I doing? What's my next PSA going to be like? And that does exist. And you heard a few comments about that. Stick with it. And then another big concern is how frequently do you need to get a biopsy? Should you do it once a year if you're on active surveillance? With the improvements on MRIs, the best solution recommended there was get an MRI. And always get a second opinion if you're going to have a biopsy. And if you're going to have a biopsy, it's a targeted biopsy. And the 4 is the key number to watch. If you get a Gleason of 6, that's 3 plus 3. The real key determinant, do you have a 4 in there? A 3 plus 4 or a 4 plus 3? Because that's the keystone for where it is. If you got a 4, now you're in the margins there. So that's why it's important to get a second opinion. Some other notes on ADT. Lupron gets the PSA down. We had a good talk by Dr. Lamb, and he's going to be our speaker here. And when is that going to be? November. Okay. 2 more months, so I don't want to preempt him, but he defined Lupron as a good way to get the PSA down, and recognition that some have a problem with it. He talked about HT Light, which is Casodex, and HT Light, which is Avodart. Combinations of HT ingredients seem to have a value for some, and intermittent has also some value. I'm on intermittent, and so is Bob on our ADT, and it works for us. May not work for you. Weightlifting is good for you. There you go. This is for your bones. So weightlifting is very important. Aerobic exercises are good, but it's really important to stress those bones to keep them working. Okay, sexual complications. Maybe none of you have those, but that was a subject, a very interesting talk. And active surveillance is the best approach if you're concerned about sexual performance. So there's another boost for active surveillance, because the other treatments are going to have negative impacts on it to a certain degree. The point is, any treatment is not going to improve your sexual performance. Another one is adrenaline is the #1 cause for erectile dysfunction. Anxiety, worrying about it, stress, and all that. So you start worrying about it, it's not of help. Okay, final comment, 2 takeaways that I got out of the meeting, is well worth the money. Water is the best disinfectant. That's from a urologist who talked about urinary infection. Drink a lot of water. That's the best thing you can do for it. Another one, there was a question with regard to, is there something like Viagra for women? And there may be on the horizon, but nothing yet. But the doctor gave us men a clue. What is a good female aphrodisiac? Is for men to do laundry and do dishes. Take note. Don't you agree, women? Yes, it works. Thank you. Anybody have a stimulating question they want to bounce off this group, or Lyle or Gene? Any questions before we go into networking? That's less than Lupron. It's not an injection. You take a pill, and these things are. That's what I'm on. I can't take Lupron. It's a thing that was advised to me by both our friends here, Lyle and Gene. It works for me. Instead of an injection, which just shuts down all of your testosterone, it just shuts it down. Caused me all kinds of problems. Where Casodex and Avodart focus in on dihydrotestosterone. My testosterone is 600. My dihydro is non-existent. My PSA is 0.2. So it works for me, may not work for you, and so forth. And Dr. Lamb said they like Lupron because it gets your PSA down. It's a good impact point. But I find that Casodex and Avodart keeps my PSA down, and I don't need the Lupron shot. So that's where they call it light, and that's what I'm on. I'm on light. Works for me. Okay, let's break it up. Any other questions? Okay, we're going to break up into a little support group.